Thanks for being with us today. We're excited, as always, to be here for our Women in Rheumatic Health series. This episode, called Friends and Family, How to Support Someone with Rheumatic Health or with Rheumatic Disease, is a really important topic. And we're thrilled, as always, Katie and I, to be here with Dr. Michelle Koolaee. And yeah, thanks for being here.
We appreciate you. I'm Katie Seymour, VP of Program and Community here at My Care Friends. This episode is especially meaningful to me because of all of the stories I've heard from our My Care Friend community and really my network in general. This topic is important, and I'm not really hearing about it in kind of our generational world right now. So I'm excited so much to talk through this. So thanks so much for being here. I know, Todd, you had a great question about why support matters. For Dr. Koolaee, I'm going to let you take the lead on that.
Yeah. So, Michelle, from your clinical experience, what impact do strong support systems have on someone living with a rheumatic condition?
Thanks for that question, Todd. And I'm delighted to be here again, talking about a very, very important topic. I think support is so important. Support people that have great support do better and they have better health outcomes, period. Whether it's for physical support, whether it's emotional, psychological, social well-being, I think it's just so fundamental to someone's health journey is having great support.
Absolutely. Yeah, I think about this from my perspective as a caregiver to my parents, and my kiddos for that matter. And I know that it's important for us to feel supported, especially in the generation of my mom and dad, the boomers, to trust. I know my dad, just a quick example, just had a phone call consult with his longtime doctor, and he was very anxious about the call prior. I could tell when we spoke in his voice, and his demeanor literally an hour after the call was night and day. So it's one of those things that, when we trust our system, when we trust the people around us, when we trust our providers, it makes such a huge difference. This idea of empathy and understanding our unique lived experiences. Um, I'm curious, what's something that you often don't see loved ones do around like rheumatic diseases and so on?
So, no, I love that topic. I love that, and I think it's important that we're talking about it. I think that a lot of the symptoms, specifically with rheumatic health, are not visible. Someone can look completely healthy on the outside, and it's you can't tell just how significant their struggles are, whether it's fatigue, and a lot of individuals with rheumatic disease have significant fatigue. This is not just I'm a little bit tired. This
Yeah.
is disruptive. This is disabling. And it's hard sometimes for friends or family to understand why plans are canceled. And it's not anyone's fault. I think it's just that's the nature of rheumatic illnesses. I think that's number one. Number two is that the pain, the flares can be unpredictable.
Mm.
And in that moment, that person that's suffering, it's hard for them to be present. It's hard for them to be engaged. It's they can be irritable sometimes because it's just really gets it's just so significant and so hard managing those symptoms and then also just the disruption of the routine, plans changing last minute. I think that it is just it's very important for friends, for family to have that empathy and to know that it's not that person's fault but they're truly suffering and they're truly navigating symptoms that are very difficult, but that are not visible to on the outside.
Yeah, those are all great points. And, I can add from experience with my mom, this leads perfectly right into it. With all of those, she has systemic scleroderma, an autoimmune disease, which affects so many aspects of her body and life. So you talk about unpredictable fatigue. It's interesting. It's unpredictably predictable, is what
Yeah.
I would say.
Mhm.
It happens and it happens frequently. Often people are feeling it every day. My mom is often talking about the fatigue she feels, and then the pain variability. It's just incredible. You'll feel it in all different places, and a big part of that is she often wonders, is there something else wrong? What else is going
Mhm.
on? She feels something maybe in her upper extremity, but then her low extremity or her back.
Right.
And so it can be very scary, not just from the pain variability standpoint, but what else might be going on. And the brain fog, knowing that she's crystal clear one moment and could be an hour later, could be a day later, whatever. She's not, because she's in that brain fog area. And it, to your final point there, it totally disrupts routines, um, for her first and foremost, and then for everybody, the caregivers around her, and what they're doing and what they need to do, because something that was being planned to be done at 10 a.m. can't be done because she's not ready. And,
Right.
and if it needs to be done later, it's shifting for the caregiver, shifting their schedules around. So all great points.
Yeah, that's really tricky. It makes me think I was one of my girlfriends, again, I'm a mom, I've got parents, I've got kiddos, sent me an article the other day from Cleveland Clinic actually, and it's on the depleted mom syndrome. I'm like, oh dear, there's a syndrome now. And I think it goes to your point in terms of the plans component. I think sometimes as people, moms, humans, friends, whatever our identities we want to recognize with, um, sometimes we don't cancel those plans or we feel this immense guilt. And you know, I think a lot about my community and how should my friends and community respond in these moments. It's almost like a grief component or some, kind of that grief thought. So I'm curious about that.
So I think that no, that's also important to be discussing, and I think that being a caregiver, friend, family, I think it's just recognizing that the need for empathy in these cases, and that just letting them know, hey, it's not your fault. Don't worry about it. Everything is okay. There's such a heavy weight that is on those individuals that are suffering and that are having to cancel.
Right.
And I think that it's incredibly comforting to just acknowledging, hey, it's okay, like it's fine, and not allowing them to feel guilt. And also, I mean, even just being flexible with plans, and that rather than being out, a day at Disney here, walking, and that where that might not be conducive to that person, is just offering to come over. Let's have some tea, let's hang out, let's enjoy each other's company. Something a little bit more low key is one example of, just as a friend or family, just being flexible, being supportive, and just kind of meeting them where they're at, I think is really important, and just being very intuitive, and empathic. And that's different from sympathy. It's being
Yeah.
empathic. It's uplifting them, and I think that those things make a really big difference.
Yeah, no, those are great points. It actually tied into our next topic. And so, Katie, can you talk about situations where we found certain support especially meaningful? And you could talk from personal experience
Yeah.
or others you've heard from, related to maybe childcare help or household tasks and so forth.
Absolutely. Yeah. I think that's a really important component. As a friend who, or a caregiver, or someone on the outside who's dealing with some really difficult situations with family members and so on, kind of on the outside piece, if I put myself in those shoes, I think asking what support do you need is great because that shows empathy. I think really reframing it to tactical, practical support and saying things like, can I help you pick your kids up from school? Can I help you with childcare? Here's how I will do this. I think taking it the next step, because I mean, we all care about our community and our friends and want to do the help. But what I've learned is don't be afraid to make those suggestions. Because oftentimes I know for myself, I've accepted them and it has impacted those little tiny things make such a difference when you're dealing with these kinds of situations in these difficult times. And the last thing I'll say is I think a lot of people think that they're overstepping. And we as the recipient can always say, no, I'm good, right? So I think it's providing those specific examples that are really important.
Yeah, Michelle, did you have?
Yeah, and I think that also being on that, piggybacking on your point, Katie, about being specific, is that not sometimes just asking, what can I do for you? What do you need? It's putting it on that person of
Yeah,
like, I have to think about what like it's just more for that person to do. Whereas what you're mentioning is, hey, can it your arthritis is flaring. Can I order you food in? Can I drive you here? Like, and not assuming what they can or they cannot do,
right.
that just
Yeah,
kind of trying to be as specific as possible, but then acknowledging that it's okay not to know. It's normal not to know exactly, what do you need? And like, and, but I think just it's that level of, like you're caring, you're present, you're there. I think that they feel that when you ask specific questions, whereas, yeah, I think just, hey, what can I do today? Like it is just, sometimes that's not as helpful.
yeah, absolutely.
Yeah, absolutely agree. I've heard that over and over again from advocates and from folks who are trying to help. It is
Mhm.
about being specific, giving ideas, because they can be overwhelmed and they might not want to, even if they have something in mind, they may be afraid of getting turned down if they do
Right.
ask something. So by putting something out there, it's giving them validation that, okay, yeah, it's okay to ask and it's okay to give some specific examples. So, we've been talking now about the emotional support and validation, which is great. It's so important. It's about, being present. You want to be present. It's important to be present. And you alluded to it earlier about avoiding minimizing language. The folks are going through difficult times. So if something's not happening, it can't happen at a certain, it's not working with our schedule. Sure. Is it difficult as a caregiver to have to rearrange stuff? Yeah,
Yeah.
it can be, depending upon what's going on. But to help make that person who is not well, who's dealing with something, not feel shamed for feeling the way they just feel, yeah, we'll make something work. And so it lessens the burden, because that's even I would imagine, even more important, because with autoimmune issues, rheumatic health, stress is a big factor in that. So if we're inducing more stress, it's going to make the situation potentially even worse. If we can help lessen, potentially lessen.
Yeah, so I was also going to say in terms of just emotional support and validation, what you're saying is that probably one of the phrases that the worst things to say is like, I know how you feel, I know what you're going through. Like it's just like cringe or like or people I think are well intentioned, that like they want to be positive and they sometimes they don't know what to say, truthfully. I've had people like share with me, their support are telling them, well, yeah, you've got this like horrible arthritis, but at least you're not dying from cancer. At least it's not terminal. And it's like so minimizing
Yeah.
of and of their struggle. And I think that on the note of like what can caregivers or friends or family do, I think it's really just acknowledging and validating, this is really hard what you're going through. I just saw a patient this morning who's navigating through a woman with new autoimmune diagnosis, and she has a couple of other chronic health conditions. And I just told her this morning, this is really hard what you're going through. And you're doing an excellent job advocating for yourself, navigating through this. But yeah, it's hard. And I think sometimes people, they don't hear that enough of like
Right.
that is being present, that is validating.
Yeah, as you said, even as simply just saying, hey, I'm really sorry you're going through this. I mean, rather than trying to flip it around like you were talking about, that can go a long way. It's a simple statement. And even if they don't understand, people want people to feel like they understand. And it's impossible to understand unless you're in those shoes and you're dealing with that.
Yeah.
Yeah, definitely. Um, so how do both sides maintain healthy boundaries now that we're talking about communication? Um, can you shed some light on that?
Yeah, boundaries, it's like one of the most important elements of being a caregiver. And I can say just personally, I have a son with moderate to severe autism who has significant disability. My elderly mother-in-law is living with us, and there's a lot of it's very important to be sustainably a very good caregiver and present. Is you have to recognize as a caregiver, your own limitations. Human beings all have a capacity, and you don't have to do everything, and you don't have to, and that is just, I think that is a boundary, and acknowledging that and being aware of that, and that is a must, because if we do not create those boundaries, in like a loving, graceful way, a compassionate way, then human beings can burn out, and it is a real thing, caregiver burnout. And I think it's important to set those boundaries. It might sting a bit sometimes initially setting them, but you have to take care of yourself as a caregiver first before you can be present. And I think that's very, very important.
Yeah, absolutely.
Yeah.
It's that saying we always hear when you're on a plane, you got to use the oxygen first before you can help the person next to you. So yeah,
Yeah.
take care of yourself. Self-care is very important.
You
Yeah,
know,
and I think sorry,
no,
Katie,
no, no.
that can take a while to be comfortable with creating boundaries,
Yeah.
right? Like it took me years to be able to be like, for years I was like, I could do it. I
I'll do
could
all
do
the things.
anything.
Yeah.
I'm
Yeah.
gonna push myself. I'm superwoman, superman, superhero. And then it's like there's a point when you're like, wait, this is like a lifelong thing. This is long term. You have to pause and you have to give yourself grace. You have to be kind to yourself first. So important. Yeah.
Yeah, I was going to actually echo that point because yes, it is a very, very difficult thing. And then, the Energizer Bunny, you just shut down. One thing to that is I have learned boundaries can be in something internal. So oftentimes you know, if I'm caring for a parent or a kid, I don't necessarily need to say, this is my boundary. I'll speak to you here, here, here. It can, it doesn't, not that I'm saying it needs to be sneaky. It really is an internal thing. And oftentimes I've found that I know when I need to take a step back, and the other person doesn't really necessarily need to know that in that moment. And it's the permission piece. I give myself permission to do that as I'm doing my weekly check-ins and understanding what the realistic nature of the support is.
Yeah, and that can be a delicate balance for
Yeah,
sure. Like you just said, talking about internal boundaries, we don't have to tell everybody, okay, this is our boundary, because that can also challenge that
totally.
relationship, because people may be thinking, oh, well, you're not going to be looking out after me, whatever. It's working through certain boundaries. Often they're invisible to the other
Yeah.
person, but it's the balance of when do you do it and when do you communicate it. And so there is no blueprint for that. It depends on relationships and trial and error.
Yep.
So but it's something to always keep into consideration for sure. um, did you want to say something, Michelle, before we go into the
I
next?
love that. No, I love that. It's so crisp the way you describe. Yeah, just the internal boundary. And I think that's so important for people who are listening to recognize and to know that it's okay and it's
Absolutely.
important.
It truly is. So we're getting close to the end here, and now we really want to focus on, considering the name of this series is Women and Rheumatic Health, Invisible Battles. So let's talk about special considerations for women. And Katie, you want to start off there?
Absolutely. Yes. I think I've already started off there earlier on in this conversation, which I've obviously am passionate about. We hear from many women, including myself, who are juggling caregiving roles, working, managing their own condition, for example. How can friends and family and community ease that pressure? Some specific ways that you might think of.
Yeah, no, so I think number one is gender expectations. So I just met someone earlier this week. She's a physician, a retired OBGYN, who has aggressive rheumatoid arthritis. She has a special needs daughter that she's a caregiver for, who's an adult special needs child, individual, and an elderly mom. And her husband is like amazing and is like this champion superstar helper, and she spoke so highly of him. I just met her recently, and I think it's that gender expectation that yeah, that it's not, the woman doesn't have to do everything.
Right.
We are not in like the 1950s. It's like men can be helpers, everybody can be helpers. And I think that just normalizing that, and that like having it where they're emotionally present, even if it's not physically that they're helping, although, I think her husband was kind of helping in all ways, but just emotional support, I think is really, really important, and sort of redistributing tasks, um, and that as women, it's okay to allow someone to help us, and that as we're kind to other people, we're kind to oneself, and we're allowing that help and allowing that support, I think is really, really something very important.
Yeah, just to say something about that and kind of be vulnerable here. That has been a hard thing for me, to allow others to help. I say to myself a lot, asking for help shows courage. And it's okay. We can't, as you said, we can't do everything. So a lot of times it's just I need to take a step back and realize that I can't do all the things.
It's yeah, so I have three kids here too. So I think again, when the like earlier up until a couple years ago, again, I was like, no, the sign of like I can handle it all. I could take all three out. I could take all like it was like this badge of honor of
Uh-huh. Yeah.
like I could do it. And then I'm like, I could make dinner and do all this and do, and then it is just no, but like now it's totally my lens has changed where I'm like, it's important for the well-being of everybody to have,
Yeah.
there's amazing people that can be in your support circle, and that is really important.
Yeah.
Yeah, and very much for you, for your well-being is to allow that. And I know from personal experience, I mean, I felt I had to do it all. Talk about burnout. We talked about that today. I can think of twice in the first 4 years with my parents that I burned out, like seriously
Mhm.
burned out. Um, it's often, unfortunately, when we reach those moments is when we
Right.
learn. So what we're trying to do here is share this with folks so they don't get to that point where they are burned out, where their relationships with themselves and their loved ones are frayed and they're just stressed
Right.
beyond belief. So hopefully, folks, you come away from this episode and all of our episodes with a lot of information. In this one in particular, there are some points, and I'm just going to bullet them. And if anybody wants to chime in, um, one is listen with intention. So important. Validate. Don't minimize the folks that you're caring for. Ask instead of assume. Assumptions are a word that we try not to use because we can't assume what somebody else is thinking, what somebody else is feeling. It's really important to ask. And then make social plans flexible because we know things come up. So if you can make it flexible with caveats, most people in our lives know we're dealing with things, but if it makes it easier for you when you're making a social plan, have that caveat built in up front to say, hey, let's plan this, but please understand it could change. And 99.9% of the people are going to say, we totally understand, but it's verbalizing. It's about communication. And then providing specific offers. We talked about that earlier. It really helps the person who is in need of care, who we're helping. It really, really helps when we get very specific. And then back to respecting your limits, both yours and theirs. So do either of you want to chime in on any of those?
I would say I echo what I say, ask for help. It's okay. You're not proving anything to anyone, and that's something as a very type A person. Again, the badge of honor. There's no badge. So,
Well, and I think also, yes, definitely. I think also, even if it's out of your comfort zone, asking, just try it out. Give yourself
yeah.
like 2 weeks, try it out. And then, it is just when one is kind of, when you're used to doing things a certain way and doing everything, it's quite out of the comfort zone. But
Mhm.
just say, I'm just going to try it. If I don't like it, I can go back to it. But then I think once you try it and you're like, wow, I'm happier and I'm more present when I'm there, then it's like that is really it's all about sustainability
Yeah.
in being a caregiver. And a final message, if I may. So, any women that are listening with rheumatic illness, I think as you're going through this journey, make sure that you create a community of support, of love, of trust, where
Mhm.
you feel seen, you feel heard and understood. And I think that individuals that I take care of that have built that or continue to build that, that is really the key to navigating through and managing a chronic rheumatic illness.
We're so thrilled you could join us today. A lot of hopefully valuable information, actionable information for you. And we just want to wish you all a very happy, healthy holiday season and 2026.